Stiffness of chest and thoracic spine can cause different pains, and in this video I'm gonna give you a few examples for the exercises what you can use to ease your symptoms. I cover a few rotation movement exercises and few extension direction exercises. If you don't have any trauma on the background, you don't have any night pains, and the weight has been same for longer period, then this video is for you. If you have that kind of symptoms with chest issues, then it's recommended to visit doctor. Typical chest issues is felt during the upper body movement or in deep inhales, and in exercises it's good to focus on the stiffest structures. You want to get rid of that stiffness and also aim for symmetric movement in rotation. In long run, once you get the areas open and there is symmetry present, then versatile exercises is best way to prevent these kind of issues. Risk factors on the background is physical passivity and the prolonged postures. Let's start with the bow movement. In Robin Hood movement, you can put few pillows under the bended leg. Aim is to have 90 degrees angle on the hip. With that, we block some movement from the lumbar spine. When the lumbar is blocked, then we get more movement to the chest spine. If you feel that static posture for the neck is bad, then you can put pillow under the head too. Try movement for both sides. If there is a restriction present, focus on that. Also, you can try rotation with your body to put up or downwards with your hand. In same position you can do also around the world move, where the hand starts to go up above the head and during the movement you open the palm towards the ceiling. If you want to get some movement to your chest during the workday, then elevate the chair bit that the hip is way more higher compared to the knee joint. Place the hand front of your torso and tilt your chin bit down. You want to have nose pointing in horizontal plane. Then start pushing your hand front and pulling other backwards. You want to maintain relaxed posture in the shoulder areas and keep your head facing all the time forward. For extension movement, you can put your fingers crossed to your neck, lean forward and get your elbows to desk or wall. Then start pushing your sternum straight forward and you should feel movement between the shoulder blades. If you want to increase the range of motion, then do inhaling while going forward and exhaling when coming backwards. In supine, you can use 2 lacrosse balls to get the movement to really small area. Always put ball right next to processus spinosus, not under it. That bony prominent you can feel underneath the skin. Then you can move up or downwards with your pelvis. Purpose here is to get the balls right under the restricted area and then do movement with the arms. Keep your neck relaxed and then start moving your hand right next to your head in flexion. In this you can also do good mobilization with inhaling and exhaling. During inhaling you go up and exhaling you come down. Find the stiffest point and do the pain-free mobilization for a few minutes with exercise what feels good. Do exercises 3 or 4 times per day. If you are not going to get that stiff area open, then I suggest to go to manually orientated physiotherapist. If you can put your back of the hand to the ground during the Robin Hood, then put thumbs up. If you feel that stiffness of the chest is going all the way up bottom of the neck, then I suggest to check this video from the side and you can see all the stuff from the playlist. See you at the next one.